before we did it. Good afternoon. I'd like to call the Human Service Committee meeting to order. Can we start with the Pledge of Allegiance, please? I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Can we have roll call, please?
Mrs. Burdick. Here. Mrs. Ricketts Wales.
Here.
Mr. Barnes.
Present.
Mrs. Hanchett.
Here.
Mr. Healy.
Here.
Mrs. Root.
Here.
And Mr. Harris. 6 present.
Thank you. And then we need to approve the February 19th minutes, please.
Hanchett will move.
Root will second.
Any corrections or comments? All in favor?
Aye.
Carried. All right, thank you. And we will start with Anita Masson, Director of Office of Aging. Welcome, Anita, on this beautiful day.
Thank you. The first thing on our agenda is the monthly report. There's a few things I'd like to highlight. The first thing is the telephone calls at the front desk. This is for the month of January of 2025. 2,224 calls just at the front desk compared to this time last month, 1,714, or the same month last year at 1,974. So the calls continue to go up just calling into the office. Below that, our insurance counseling, which is our Medicare insurance counseling program. January, we had 728 hours of service, and our units of service, same time last year, 283. Previous month, 639. So those continue to go up as well. Transportation continues to increase, 146 units of service, same time last year, 153 this year, and 140 last month. Information and assistance, so people just looking to see what is available and trying to be connected to services, 2,195 units in January of 2025 versus 1,474 the previous month, and 1,992 the same time last year. Yes.
Go ahead.
What do you attribute those increases to?
The need is increasing. People are aging into our services, so once you become 60, you qualify for a number of services. We also have New York Connects, which is for individuals who are under 60 who have a disability. Those numbers are increasing, and caregivers.
So would you say overall our population here in the county is aging?
Yes.
Thank you.
I have a question, Jim.
Yes.
I wanted, the blue light's on now, it's not good. I wanted to ask a question about the Meals on Wheels, and I was reading up on it. There is a charge. I think the blue light's on, so.
I didn't touch anything. It went back.
Okay, it went off.
The contribution. So we have suggested contributions.
Okay.
It is a suggested contribution that is set forth by our advisory council. And the suggested contribution is just that. Nobody is denied service if they have the inability or unwillingness to contribute, but it does go back into the programs.
That's good. Do you get quite a few contributions?
We do.
Good. I was reading different counties, some are at certain prices. Are we, the suggested, is it around $4 a meal? Or
Yes, it is.
that is very low.
It is. And it is based on cost per unit, where we have the contract ourselves. A lot of counties that subcontract everything out from the
Okay.
office and don't do anything locally or within their agency. All the subcontracts actually increases the cost per unit. So it is all based on that information.
It certainly is a useful service.
Thank you.
Thank you.
You're welcome.
The congregate sites are also suggested.
All of our services are suggested contribution, with the exception of one program, which is our expanded in-home services for the elderly. Our ISEP program, one of our home care programs, is the only one that is a cost share, and if it is a cost share, then that is a bill. Everything else is suggested contribution.
Thank you, Anita.
Yep. So we'll go into home delivered meals. The other highlights, Go and Dine units, 224 vouchers in January versus 224 the same month, or last month, but 192 last year at this time. So those have gone up. Home delivered meals, 8,313 meals in January for home delivered versus 7,841 the same time last year. And the previous month, 7,994. And our congregate are also going up, 975 meals in January versus 934 the same time last year and 955 the previous month. So our congregate meals are going up, our Go and Dine is going up from last year, and our home delivered goes up every month. You
Okay, any other questions?
I got,
Mr. Healy?
yeah, on the Go and Dine. Do you have somebody that actually goes out and promotes that in restaurants and?
Yep, so we do work with the restaurants who are interested in doing the Go and Dine voucher program. There's a whole criteria that we have to go through. So there's a packet if somebody's interested, and we would send the packet out. We go out and meet with them, explain what the program is, what their responsibilities are, what our responsibilities are. Then our registered dietitian has to go out, look at the menu, and analyze it. So there's an entire process.
So is that proactive on your part, or is that or is that people coming to you more?
We actually have reached out to restaurants to see if they are interested in participating, and we've had restaurants reach out to us, so it's both.
Thank you.
And you do have a waiting list for that.
We currently do have a waiting list. Yep.
Okay, any other questions for the month report? All right, then we will move on for your MOEs.
Okay. So the first MOE that we have is request permission to enter into an amendment for the agreement with CELJ, which is Center for Elder Law and Justice. This original agreement was dated January 1st, 2025 to December 31st, 2025. Under this amendment, we are looking to increase the maximum amount that we would be able to give to Center for Elder Law and Justice from $8,900 for the year for this contract to $12,000. The rate did not change.
I have a motion to accept that.
Root will make that motion.
Ricketts Swales will second.
Any questions? All in favor?
Aye.
Carried. Thank you.
Thank you. The next one, we're looking for permission to enter into an amendment for our original agreement with Total Senior Care Daybreak. The original term of the agreement was January 1st, 2024 to December 31st, 2024. The amendment is actually just to extend this contract with no other terms changing, and the date would be from January 1st, 2024 through December 31st, 2025.
We have a motion to approve that.
Hanchett will move.
Healy will second.
Any questions? All in favor?
Aye.
Carried.
Thank you.
Next one?
The next one we have is we're requesting a resolution to enter into an agreement with Annette Harding for the term of January 1st, 2025 through December 31st of 2025. This is to provide legal services for older adults age 60 or over. She would only be doing things such as powers of attorney or healthcare proxy. And this is at a rate of $75 an hour, and that would be for a maximum of $12,000 for the contract year.
We have a motion to accept this one.
Ricketts Swales will move it.
Root will second.
Any questions? All in favor?
Aye.
And that's carried.
Thank you.
Okay.
The next one, we're asking permission to enter into a contract with Highland Park Day Program, which is a medical day services program. It has recently reopened, the first time since COVID. We did have a contract prior to COVID with Highland. This is to provide respite for our ADCSI, or Alzheimer's Caregiver Support Initiative Program, our 3E, our unmet needs. Those are our funding streams. There is a typo in this, so the rate will be $104 per day without transportation, at an additional cost of $52 for a two-way transport, or $28.08 for a one-way transport. And we did have this budgeted in our 2025 budget.
And we have a motion to approve that with the correction.
Healy will move it.
Hanchett will second.
Any questions? All in favor?
Aye.
Carried.
Thank you.
And we have another one.
We're asking for a resolution to enter into agreement with Legal Assistance of West New York, or Law New York. This is to provide legal assistance for individuals 60 or over. This does include the full bracket of legal services that our office provides. It is at a rate of $158 per hour with a maximum of $12,000 for the contract year, and it is budgeted in our 2025 budget.
Motion to approve this?
Rickett Swales.
Well, Root will second.
Okay, any questions? Just to clarify, so everybody listening knows, this is paid by the county. It is not paid by the person getting the services. That's correct?
Correct. These are legal funds that we receive from the state.
Okay, just want to make sure everybody realizes that they don't have to pay for it.
Correct.
Okay, all in favor of this one? And that's carried. Thank you. And we have another
Two
one
more.
for Life Station.
Yep. So we are requesting permission to enter into an extension of the agreement that we have currently with Life Station, which is our PERS, our Personal Emergency Response Company. This request is an extension of 1 year from our current term agreement of July 31st, 2024 to July 31st, 2025. We are going out, we have sent out the RFP that the committee had previously approved, and we are just waiting for some information back. We wanted to allow enough time for any kind of transition, so we want to enter into the 1 year extension that's in that contract.
Hanchett will move.
Rickett Swales will second.
Any questions on this?
I have one.
Sure,
Just-
go right ahead.
So are these already out with the people who use them, or no? Is that?
Yes.
And so until the end of this year, then they will, is that what it's for? The end of this year?
Yeah, so
Okay.
with this 1 year extension, it allows us to continue our contract with our current company that we have a
Right,
contract
right.
with to provide those units into people's homes.
Right, okay.
And we have an RFP out. We're getting bids, or we're getting RFPs back with a deadline in April to open them.
Okay.
And so we just want to make sure that we have enough time to review all the RFPs that come in, make the decision, and then if Life Station is not selected, we need to allow for the transition time for all of those people we're serving
Gotcha.
to transfer to a different company. We would still continue to pay for the unit, but it would just be through a different company if they
Okay.
didn't have the RFP.
Thank you.
You're welcome.
Any other questions? All in favor?
Aye.
Carried. And one more.
Okay, so this is a request to enter, or to have permission to enter into a contract with WillCare. WillCare is one of our home care agencies to provide PC Level 1, PC Level 2 services through our ISEP 3E, which is our caregiver funding, our ADCSI, which is our Alzheimer's Caregiver Support Program, and our unmet needs grants. The rate would be $31 per hour for PC Level 1, $32 per hour for PC Level 2, and the nursing supervisory visit that is required by state regulation is $175 per visit, and it is included in our 2025 budget.
We have a motion to accept this.
Root will make the motion.
Haley will second.
Okay. Any questions? All in favor?
Aye.
Carried. Thank you, Anita. Anything
welcome.
else for us today?
I don't think so. I think that was probably enough.
All right, thank you.
Have a good day.
Next, we have Tyler Shaw, Public Health Director. I'm thinking of vacation or somewhere, I guess. I wish. Good Welcome,
afternoon.
Tyler.
A couple things to highlight on my monthly report. We did start to include some of our social media postings. So there's a lead hazard posting out there, and then our septic system replacement grant social media post is out there too, so you can view that. A couple things that are not in the monthly report, but I did want to highlight our rabies clinic. I did put one of these on the desk, and I'll give one to Tiffany for the meeting minutes. Next one, free animal rabies clinic, April 26th, 9 a.m. to 12 p.m., and it'll be at Genesee Valley School Bus Garage. And the second item is our community health assessment. If you haven't seen that already, there's a big push this year. We're in a 6-year period where we're collecting some data from our residents on, their health, what their health means to them. There's some basic questions, 5 quick minutes it'll take you. But we're really looking to, this year our focus was to get over 1,000 responses. I'm happy to report as of today, we've had 1,259 responses, which is the most we've ever had on any of our surveys. We typically get about 500 every time we do this every 6 years. So this is huge. We're hoping to get over 1,700, which really puts us over that 95% confidence level, which really brings that data home. So what we use this data for, it's all de-identified. We don't use any personal information. It's really to help some of our agencies and our office write grants. So if people are lacking health insurance, we can go after certain funding to help access for healthcare services or whatever that looks like for folks. So
Great job.
that's an important
Great
important
job.
piece. Questions
So
on
the
that?
information is used by not just your department, but
Correct.
throughout the county?
Yes.
Good job. Anybody else have questions on the survey? Okay, we'll move on then.
Okay. First up is just a request to sign on to a letter of commitment with Casa Trinity. And this is for their HRSA grant, which is it's a Rural Communities Opioid Response Program, or the IMPACT grant. We've been involved in this with several other county agencies on substance abuse and alcoholism, but they're looking to reapply for another grant.
Okay, we have a motion to approve that.
Haley will move it.
Ricketts Wales will second.
Any questions? All in favor? Carried. Okay,
Next up is a data use agreement. We've been asked to sign on with the State Health Department for a biospatial interactive web-based analytics program. And this is involved in is the EMS PCR reports. So Bonnie has also signed on to this as well. So we're just looking to enter into a data use agreement with the state to access this information.
Root will make the motion.
Hancher will second.
any questions on this one?
I have
Yes, go ahead.
to create a create a public health data visualizations. What is that?
I do not know what this looks like.
Okay.
This is new to me. Someone at the state reached out. It's a student intern that's working on this project. But really, what they're hoping to do is collect PCR data from any EMS calls, especially on substance abuse or Narcan distribution,
Okay.
so that we can have a better idea of what's going on in those pre-hospital
Gotcha.
reports. Yeah.
Okay.
We're happy to share this information if we are allowed to and whatever it looks like. Yeah.
Any other questions, Mrs. Hanchett?
Oh, no, thank you.
No? Okay. Any other questions? All in favor?
Aye.
Carried.
Okay, next up is we recently, the state passed they set the rates for evaluations for in our preschool program, so they did increase those rates, so I'm just asking to adopt those increases. And if you're not familiar, we do have a 10% take back because we do serve as an agency here. We are one of the only counties in the state that does this, so we are getting some revenues back. The estimate and the fiscal impact you'll see below is just based on last year's numbers. We never know how many evaluations we're going to do per year. It's based on the number of kids that come through the program, but that'll give you at least a general idea of what we would be looking at for an increase.
Can we have a motion for this one?
Ricketts Wales will move it.
Hancher will second.
Any questions? All in favor?
Aye.
And that's carried.
Next up is a preschool evaluation and related services contract with Amy Brush, and this is for vision services.
Root will make the motion.
Ricketts Wales will second.
Any questions? All in favor?
Aye.
And that's carried. Tyler, these are all mandated programs that you have to
Preschool is a
provide?
mandated program,
Preschool.
yes.
Okay, thank you. All right, that's passed.
Next up is just a reappropriation of unspent funds for our public health infrastructure grant, and we're just moving some of our non-personal services around, and it's only $1,356. So just looking to reappropriate those.
We have a motion to approve that.
Hancher will move.
Root will second.
Any questions? All in favor?
Aye.
And that's carried.
Next up is a request for amendment to Resolution 29324. This is just some housekeeping. We have a provider that sometimes operates under the individual name and sometimes under their organizational name, their LLC. We're just looking to clean that up and just move it to their LLC, because that will match their insurance certificate as well.
Have a motion to accept that.
Ricketts Wales will move it.
Hancher will second.
Any questions? All in favor? And carried.
Next up is a reappropriation again of some unspent funds for our HUD lead hazard grant. And I've delineated how we're kind of moving that around as well.
We have a motion to accept that.
Root will make that.
Haley will second.
Any questions?
That's quite a bit of money that's left over. Do you normally?
We still have a full year left on that grant too, so
Oh,
you'll see
okay.
another one of these next year
Okay.
too. Yep.
All right.
Is that because is some of this because of the fiscal years are different on the state level and federal level than
Yes.
county level, right?
Yep, that's correct. And then if you remember, there's 6 months where this project actually is for money for the repairs. So we have money earmarked specifically for repairs once that last 6 months of the grant does hit. So you're looking at about $350,000 just on that. Yep.
Thank you.
Any other questions? All in favor?
Aye.
And that's carried.
Next up, I'm not sure if I shared in the past, but this year, one of my goals that I put out for my department was to do some radon awareness across the county. So we actually had an opportunity to apply for a grant where we're going to be able to hopefully purchase some radon test kits to distribute to the community, and they can have their homes tested, and then we can start to educate them a little bit about high radon levels in the county. So that's what this request is for, to apply for the Allegheny County Area Foundation grant in the amount of $1,500.
We have a
Hanchett will
motion.
move.
We have a second.
Second.
Any questions? This is new, you've never done this before, provided.
This is new, yep. And I know it has my signature on it. I'm looking for ratification for my signature. We had a day turnaround to apply for this, so I thought it was important enough. But if you said no, we certainly would rescind it.
All right. Any other questions? All in favor?
Aye.
All right, and that's carried. Good luck getting that.
Next up, it looks like they're the same, but they really are. I do have 2 nursing positions, so we'll do one at a time. First is a request to fill the registered nurse position. We did have a resignation.
Root will make the motion.
Ricketts Swales will second.
Any questions? So the 2 positions, they're for 2 different departments? Or
We've had 2 resignations for
had
2
two.
of our nurses, yep.
Okay, all right, so let's approve the first one, all in favor? And that's carried, and then the second one is the same?
Same exact thing, request to fill the other registered nurse. So they're working in multiple programs. You'll see the first one's communicable disease and immunization and lead. Our second one does do communicable disease, immunization, and lead, but also works in family planning and some other programs that we're involved in too.
Just point out, these are all 100% funded by the state.
That's
Is that
correct.
Thank you.
Okay, can we have a motion to accept this one?
Hanchett moves. Ricketts Swales will second.
Any other questions? All in favor?
Aye.
And that's carried. Anything else for us today, Tyler?
The last thing I failed to mention, a huge shout out to UR Jones. We had a measles exercise a few weeks ago, and it really helped to flush out some of our processes between the hospital and our office. As you know, New York City has had some measles cases, so we're just preparing, and nothing to be alarmed at this point. Fairly low risk for our residents, but we did want to be prepared in case something does happen.
So it went well?
Yeah, went very
Did you-
well.
Did you find any things that need to be corrected or changed?
Just some contact information, so updating some of our policies, updating some contact sheets that are fairly old on our end, on their end too. So yeah, it helped to bring those to light. Who do we call in these situations? Yep.
Very good. Any other questions for Tyler today?
Yeah, I do. I want to go back to the 2 nurses' open positions. Do we know where or why they resigned? Are they staying in the area or leaving the area? Do we know?
One is going back to the hospital. Our work is less patient care oriented and more computer-based work. So
Okay.
I think they were really happier in the
Okay.
hospital, which does make sense. Yeah.
And that
Yeah.
makes a lot of sense.
Yeah.
Any other questions? Okay, thank you, Tyler.
Thank you.
Okay, next we have Don Horan, Commissioner of Social Services. Welcome, Don. Not quite as much for us today, but always important.
Good afternoon. The monthly report, Code Blue Nights were up, which we all expected. They'll be the same in February. It was very cold. The other one on the first page is under Child Protective Services. You'll see that the caseload there jumped up a little bit. We did get 39 new cases that came in, but we were able to close out 14. And a lot of the 151 are cases that we're still working on that carried over from last year that carried into January. Also, under CDPAP, which is Consumer Directed Personal Assistance Program, the state has started their takeover of the program with their contractor. So we are transitioning our 22 people over to the state. We've done our work. We're waiting for Public Partnerships LLC to do their piece, and then that should be completed. We work on that at least every day in Adult Protective Services. In the Program Integrity Unit, our numbers also jumped there. We had 34 front-end detection cases come in that we reviewed, and 17 cases of the 51 are carryover from last year also. Are there any other questions on the monthly report?
All right, if no questions, we will go on to the contracts.
Okay. I'm requesting a resolution to enter into contract with Hillside Children's Center for the One Family services that they do for us. This is a preventive services that is strength-based for families, and it helps to work with children and their parents to form better relationships and work on other family values.
Okay, can we have a motion to accept that?
Ricketts Swales will move it. Hanchett will second.
Any questions? All in favor? Aye. Carried.
Okay, the next one is a grant that we were able to apply for that we sought permission for last year. This is for the CAC. This is a technical grant to purchase equipment for the CAC. We need to accept and appropriate it. We're going to use it for a couple iPads, for some external hard drives for storage of some of the cases that we review, Microsoft Surface Pro, and we're going to upgrade the iRecord camera system that we use over there for investigations. And that's it.
Root will make the motion to approve.
He'll second. Okay, Don, can you just remind the listening public what the CAC is and how vital it is that we for those services?
Right. The CAC is a child advocacy center. That center works hand in hand with Child Protective Services for abuse cases and sexual abuse cases of children. And we take them in and we analyze what situation could have happened or did happen. And we advocate for them to put them in safe places to stay, or we advocate for them for mental health services, and we would also advocate or accompany them to go to court.
Thank you.
Are we using the Winnebago?
Yes, we are.
Okay.
Yep.
And where's that parked now?
It's parked at the sheriff's office right now. I think we're going to relocate that down to Wellsville. So,
Great. All right. Any other questions on this? All in favor? Aye. And that's carried. And one more.
yep. The last one is a award that we were notified of from the Office of Children and Family Services. This award is for the recruitment and retention of foster parents. We can always use them, and we would use the money for supplies to set up informational booths at maybe some job fairs or other functions, maybe sweatshirts, promotional material, advertising software for the internet. Also, staff and I have talked about doing radio ads, maybe putting a billboard up to advertise to recruit more foster parents.
Can we have a motion to accept that?
Ricketts Swales.
Root will second.
Any questions? Okay, all in favor? And that's carried. Thank you, Don.
Thank you.
Don's going to stick around for a minute here, so. Dr. Anderson, it's your turn. Welcome.
Thank you. I came because I thought perhaps some of you might be interested in how things are going with our move and how we've made the transition. Not fully quite yet, but everyone has their assigned space. Everyone has their working telephone, and everybody but me has a working computer. Mine has a loose connection somewhere. Corey is very good at telling me what to do. It was a tough move. It was difficult because of the weather, the amount of accumulated antiques that we had acquired over 32 years. And I think DPW, I couldn't even tell you how many times they went to the dump or how many times they backed their trucks up to our boardroom to get everything out of it. They did a remarkably wonderful job of making sure that everything got placed where it was supposed to be placed. So we're in there. People are finding us, some that we probably would rather they didn't, but most of our clientele are finding where we are, and we're able to continue on. I will say one thing really positive. It's nice to have a parking lot. You probably all know that, don't you? It is big enough for us, and we really are very happy. So if you've got any specific questions as to what we've done or what needs to be done.
Mr. Barnes?
Yes, the rear area that, is that still got a possibility to be rented out?
Yes.
What's the status of that?
Are you familiar with DASNY from New York State? The, what, dorm, they are sitting on it. And I don't necessarily mean that negatively. I mean, it has to go through their process. And as of last Thursday, they were supposed to be sending somebody by the end of March to look at it, to make sure that the Elmira Psych Center could use it. It's part of the process.
Do you have a list of requirements that it must meet, and?
No,
So you don't know what they're looking for?
no, I don't.
Is there anything we could do in the legislature to assist you in this?
I don't think so. I think Carissa's on top of it. I think she's, thank you.
Thank you.
I don't think that going political with DASNY is of any benefit.
DASNY is just notoriously slow. And if anybody on the board remembers the conversation, we used DASNY on the ground floor here and DASNY on the third floor renovations. It took several years to be reimbursed for our money. I think maybe 4 or 5 years. They are slow. So I have heard there might be some reforms coming for them from the state, but I'll keep my fingers crossed.
Any other questions?
No other questions? All right.
We do appreciate the opportunity to have a new place. It's much appreciated.
It is quite different from the old building, that is for sure. It's very nice.
When we get a couple more months in, I would like to revert back to our custom of 10 years ago where we invited the legislators, particularly this committee, to come and not just see our building, but also to tour the agency buildings with whom we have contracts.
That would be great. I'm sure we would all like that. Yeah, thank you.
Thank you.
All right. At this time, we will go into attorney-client session, please.